You walk out of a routine checkup? You might be holding 5 referrals in your hand. First, there is a lab panel document, then an imaging order form, and 3 specialist appointment cards. And somewhere between the waiting room and the parking lot, a quiet, uncomfortable thought crosses your mind. Was all of that truly for me? Or was some of it for the clinic instead? That question deserves a serious, honest answer. Not an accusation and not a conspiracy, but a calm, informed look at the structural realities that every patient over 60 should understand. Today we're going through 5 specific patterns. These are the patterns that research has identified. Knowing them won't make you suspicious. It will help you become a more precise participant. The goal here is not to make you skip necessary tests. Always remember that some tests save lives. Some referrals are exactly right. The goal is to help you ask the right questions, so that the tests you receive are the ones you genuinely need. Let's start with the system itself. Most medical care in the US operates on a fee-for-service model. In this model, clinics and systems are reimbursed. A study found 1 in 3 hospital tests were unnecessary. More tests, more procedures, more visits, more revenue. This is the documented architecture of healthcare finance. A survey published in PLOS One. The survey asked over 2,000 physicians to estimate care. The median response was, that includes nearly a quarter of all diagnostic tests. Leading drivers identified were fee-for-service structures. This does not mean your doctor is acting in bad faith. Most are genuinely trying to help, but they work inside a system. Financial incentives don't always align with necessity. Sign number 1, the in-house referral. Your doctor tells you that you need an MRI or a blood panel. They direct you to a facility they already own. This is called a self-referral. It is a documented source of overutilization. When a provider profits from downstream services, there is an inherent incentive to recommend more. The question to ask is simple. Ask if there is a clinical reason for this facility. A doctor ordering it because you need it will have no difficulty answering. Sign number 2, aggressive screening past the age guidelines. This requires nuance, as screening is not universal. The U.S. Preventive Services Task Force has found colorectal screening over 75 has small net benefit. It should be offered selectively, not automatically. On mammography, evidence is insufficient for women 75 or older. These are not fringe positions. They reflect clinical reality. As we age, the risks can outweigh potential benefits. Complications from sedation or the anxiety of false positives. For adults over 85, screening is not recommended. Ask, given my age, what does the evidence say about this screening? You are entitled to a complete conversation about your health. Sign number 3, the panel of tests for a minor symptom. You come in with something mild, a minor digestive issue or fatigue, and you leave with orders for 15 or 20 tests. More information sounds like better medicine. It often isn't. A study found roughly 1 in 3 hospital tests were unnecessary. Over 70% of patients had no change in treatment based on those results. The specific risk of overtesting is the cascade it creates. A borderline result triggers a follow-up. The follow-up triggers a referral. A patient undergoes an invasive workup for nothing. Ask, which of these tests is most likely to change how you treat me? Is there a reason to order them all at once? Sign number 4, the absence of any suggestion to wait and see. You have pain in your lower back. It started 2 days ago. No falls. And the first response is to order an MRI. Guidelines for uncomplicated back pain recommend conservative management first. Rest, movement, physical therapy. Most episodes resolve in 4 to 6 weeks. Physical therapy can resolve this in a few weeks. An immediate MRI often reveals clinically insignificant findings. This generates alarm and is called incidentalomas. Good care often looks like a defined period of conservative care first. If you are not improving, imaging is next. If wait and see is never offered, it's worth asking for it yourself. Sign number 5, the just to be safe test with no clear purpose. Your doctor says, I'm going to order this test just to be safe. But there isn't a clear answer about what would change in your treatment. This is called defensive medicine. It reduces a physician's liability. This is not a moral failure. It's a response to a liability system, Mazel Tov. The most powerful question is, if we don't do this today, what happens? What is the most likely outcome for my health over the next 30 days? Without this test, we risk missing important details. If the answer is specific, the test has a clear clinical purpose. If the answer is vague, you have the info you need for a better talk. Decide if the test is serving you or the system. Let's bring this together. 5 patterns worth knowing. Recall the 5 patterns we have discussed today. These patterns don't mean bad faith, they mean structural incentives. The system doesn't always align with your individual clinical needs. Your best protection is informed, specific, respectful questions. Get a second opinion when something feels unclear. It's not rude. Have you ever left an appointment with a feeling you couldn't name? Please share your experience in the comments. Stay informed, stay empowered. I'll see you in the next video. Take care of yourself. Goodbye.